Hi everybody, hi, I'm Dr. Karan Pramod and I'm your faculty for forensic medicine. Today we will be discussing about important images, important cases, important MCQs which are just and solely based on images, and how should you attempt them, how should you neglect the wrong options, and how should you come up to the opinion. So let us begin this series known as Image Advantage series. All right. So question number 1. If you get a person that came to the casualty with history of snake bite and developed pain over the bite site along with ptosis of the eyes, what is true about the snake? Okay, so first you need to know what is true about the snake. So here they've already told you that this is a snake that we are talking about. This is having ptosis. All right, so now you need a question which has an image like this. Identify the snake. The identification is based on look at this hood present over here. Then we have this spectacle mark present over here. So obviously this is a cobra. So now we have to look at the options. The cause of death is hemorrhagic shock. The blood tests show rhabdomyolysis. The snake is identified as viviparous. The cause of death is respiratory paralysis. So you should know that the most common snake bites that come are cobra versus viper. Okay. So does a cobra cause hemorrhagic shock? No. A cobra does not have hemorrhagic shock. The blood tests show rhabdomyolysis. So rhabdomyolysis is shown by myotoxic snakes. So myotoxic, is it a cobra snake? No. Sea snakes are myotoxic snakes. The snake is identified as viviparous. Is the cobra a viviparous snake? No. The snake is, what is cobra? It is a oviparous snake. Okay. The cause of death is respiratory failure. So now respiratory failure here is the correct option. So option D is correct because cobra is a neurotoxic snake which is causing death by respiratory paralysis. So remember, okay. Now looking at the next slide here shows you the 4 big snakes that are here. What you should remember are common crate, Russell's viper, common cobra, and saw-scaled viper. Why do we need to remember these 4 snakes? Because these have the maximum snake bite cases in India. And why do we need to remember these 4 snakes? Because of the vaccine that is available, which is a polyvalent vaccine. So it is not a monovalent vaccine these days. It is a polyvalent vaccine. So poly means that it will cover all these 4 snakes together. So if a person comes to the casualty with a history of snake bite, with an unknown snake bite, so you have to just give the polyvalent snake vaccine, and then looking at the symptoms, the case is managed likewise. Now, the key differences between cobra and viper should be known because the most important questions are going to be only based on cobra and viper. Remember, a cobra's head that we talked about, it should have a spectacle shape on its hood, and whereas a viper has a triangular or a V-shaped head. And what are the pupils? The pupil differences: a cobra has a circular pupil, the eyes are circular, whereas in a viper, the eyes are slit-like. Then the tail is less tapering in a cobra and the tail is more tapering in a viper. Then we talk about the fang marks. The fang marks are shorter and grooved in a cobra bite, whereas in viper bite, it is longer and channeled. Now, very, very, very important difference here is a cobra bite will have fang marks, but will have other teeth marks also. Whereas a viper bite is only going to have fang mark bites because it does not have other teeth present in the upper or lower jaw. Whereas a cobra has other teeth also present in the upper jaw. And as we talked about, the oviparous snake is cobra and the viviparous snake is viper. Okay. Question number 2. A person, in order to take revenge from another person, remember revenge word is here, mixed the root of this plant in food and served it. Following ingestion, the person presented with cardiac arrhythmias and alternating contracting and dilating pupils. What is true about it? So the key features here is that the poison was mixed with food. All right. So that means that something is easy to give in food to cause a revenge, to take a revenge. So this person put the root of this plant. Now we look at this image. What is this image? If we see bell shaped flowers like this bell shaped flower is of the plant aconite, okay, which is also known as the monk's hood or wolf's bane plant. And now look at the options. Only the root of the plant is poisonous. The question says root, but we know that if this is an aconite, only the root, nay, all parts are poisonous. It has a very pungent smell and bad taste. No, because it was easy to give in food. So it is not the correct answer. It is a common suicidal poison. No, it is not a common suicidal poison. It is a common homicidal poison. So we're talking about poison that can be easily given in food and mixed to take revenge. So it is a common homicidal poison. So this is the correct option. Now the plant we showed, and now this is the root of aconite. So if you remember, if you get this picture also, you have to remember that this is the root of aconite. What does this resemble with? This resembles with a horseshoe radish. Why do we need to differentiate it with a horseshoe radish? Because a horseshoe radish almost looks like this, the root of horseshoe radish, but this horseshoe radish is taken into consideration when we are talking about blood tests. Okay, why? Because this will give a false positive for blood. Why does it give a false positive for blood? It gives a positive for the peroxidases present in stains. So whenever we have a stain in front of us, which is a suspected blood stain, if it is suspected, we make sure we run through some tests because the blood also contains peroxidases. So now this horseshoe radish also has peroxidases and it will give a positive, whereas it is a false positive because of the peroxidases present. So it is not blood, it is just some horseshoe radish. Okay, just a differentiating point which you should remember, that because both these roots resemble and they're important in forensics. What is this image showing you? This image is showing you a phenomena known as hippus. What is hippus? It is the alternating contracting and alternating dilating pupil. So as we talked about in the question, it says the pupils were alternatingly contracting and dilating. So this phenomena is hippus, which is present after aconite ingestion. If you remember the series now, so forensics should always be linked to pop culture with movies because it's everywhere. Okay, if you link it like that, it will be very easy for you to remember. So this actor, if you know, he is Saif Ali Khan. So this series was known as Tandav, and the series showed that this nemesis of Saif Ali Khan was killed by easily giving aconite in his tobacco and juice. So he killed this person by aconite. And another pop culture reference is Harry Potter, where this dog, if you remember, was part in the part 1 of Harry Potter and Philosopher's Stone. He is called Cerberus. So this three-headed dog was protecting a plant known as aconite. Okay, so remember, just an easy way to remember aconite. What is lycanthropy? Lycanthropy is when in old ages, in medieval ages, in witchcraft, werewolves were there. So humans turned into werewolves, and this act or this disease was known as lycanthropy, and aconite was used as a treatment here for lycanthropy. So just some important pointers, some medical legal significances, and to remember what aconite is important for. Question number 3. A chronic abuse of white powder for recreation leads to following disorder where the patient feels multiple bugs crawling under the skin. So multiple bugs when they are crawling under a person's skin, like this image shows you, this person feels that there are multiple bugs and this person ends up scratching their body continuously, creating these multiple injuries which could be abrasions, multiple abrasions. And what is this disease known as? This disease is known as a Magnan syndrome. So Magnan syndrome is related with, you look at the options, heroin, LSD, cocaine, MDMA. Magnan syndrome is associated with cocaine. Okay, so cocaine is a white powder that is for recreation, so you get your answer from that. Also, if you are very confused if it is heroin or cocaine, remember Magnan syndrome is associated with cocaine and not with heroin, because heroin is also a white powder eventually taken for recreation. So cocaine, the plant is looking like this. So if you get this picture in front of you, these red fruits available on such a plant, that is also cocaine, but this plant is known as Erythroxylon coca. Okay, how cocaine is formed from this? So cocaine is available, that the leaves of cocaine are treated with sulfuric acid and HCl. When they are treated with this, cocaine hydrochloride is formed. If now cocaine hydrochloride is important because it can be taken either in a snorting way, injected, or it can be smoked. So if it is snorted or injected, the act is called freebasing. Remember, freebasing. If it is smoked, the cocaine is called as crack. So this is a common term used for cocaine. Other common names are devil's dandruff, blow, or coke. And what is the type of poison? The type is a deliriant poison, remember. And what are the symptoms? So symptoms are very, very important here. Two stages are there, rush and crush. Why do we call it rush and crush? So this person, whoever takes cocaine or ingests it or smokes it, will have immediate sudden symptoms right after ingestion, and they are known as people have a rush. So those rush have flushed, hyperactive, tachycardia, euphoria, grandiosity, and hyperthermia. And a person, as soon as they take cocaine, there is a phase of depression right after 1 hour, which is known as a crush. So the person crashes immediately and goes into coma, flaccid paralysis, apnea, ventricular dysrhythmia, and respiratory failure. So this is how overdose of cocaine can kill somebody with this respiratory failure or ventricular dysrhythmia. This image here is again a pop culture reference. This movie was known as Project X. So they were taking cocaine into it. If you've seen this movie, you remember how cocaine looks like and what does it cause. Other important features or medico-legal importance of cocaine is chronic cocaine ingestion is known as cocainophagia or cocainism. And what are the other things other than Magnan syndrome? Nasal septum perforation. So if a person is continuously ingesting cocaine, this person can have a nasal septum perforation. Crack babies are babies who are premature to SIDS. What is SIDS? Sudden infant death syndrome. So SIDS, people who are ingesting cocaine chronically, women who are ingesting cocaine, and if they are pregnant, those babies are more prone to SIDS, also known as crack babies. Then another important feature is black teeth, which can be caused by chronic cocaine ingestion, is when if a person is having an act known as bruxism. So bruxism is more of a habit, is the constant grinding of teeth together. So if a person is constantly grinding their teeth, they will have a loss of enamel plus black teeth nearby the gums. Then the next important is a gold chloride test. So gold chloride test, remember, it is a test done on urine. So if a person is suspected to have cocaine ingestion, if a person is coming to your casualty, and if somebody suspects it, urine can be tested, and the test is known as a gold chloride test because of these yellow birefringent crystals that are seen because of cocaine when acetic acid is mixed with the suspected material. Next question. A traveler on a bus was given some unknown prasad and developed dry mouth, dry skin, and dilated pupils. What is the toxin and treatment? So, two things are asked here, but the two things are linked because they're talking that it has a dry mouth, dry skin, and dilated pupils. Okay, so what is the toxin? You look at this plant, this image given to you. What is this image? This is known as a thorn apple, which eventually means that this is a Datura fruit. And what are these symptoms associated with? This fruit contains Datura seeds. So these seeds have these symptoms, which are D, 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 dry mouth, dry skin, dilated pupils, and there are at least 8 to 15 Ds that are there, which I'll just show you. But remember, whenever this image is showed you and not the seeds, remember this is known as a thorn apple, which has the toxin. Now look at the options: atropine and physostigmine, atropine and pralidoxin, adrenaline and physostigmine, and acetylcholine and pralidoxin. So remember that atropine is the correct option here, which is the toxin. So now if you have two options along with the treatment, so if it is physostigmine and pralidoxin, the correct is physostigmine, because pralidoxin is also known as oximes, which are used in organophosphorus poisoning. So agriculture poisons में organophosphorus poisoning में pralidoxim is used as a treatment method, whereas physostigmine is the treatment of choice in Datura poisoning. So remember that when you have a image earlier as shown, or either these seeds, remember that we are talking about Datura. Now Datura has to be compared with chili seed. What chili are we talking about? We're not talking about the green chilies that are easily sold. We are talking about capsicum. So remember, capsicums are also known as chili in other countries, and this chili seed resembles the Datura seed, but the larger difference is that chili seed is a smaller yellow seed, whereas the Datura seed is a larger and brown seed. And the most important difference here is that when talking about the embryo, so a chili seed will have an embryo inverted like the figure of 6, whereas the Datura seed will have a embryo outward or everted, which is curved outward. So once you break open the chili seed or the Datura seed, you will look at this. Okay, because these things resemble in picture, that is why they are both compared. Other symptoms of Datura poisoning, remember it is associated with D, 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 D for Datura and D for poisoning. So D is dry and hot skin, then dilated pupils, dilated vessels, delirium, dermatitis, dysphagia, diplopia, delusions. Now, there are other names that have been given to Datura, which are Jimson weed, Lockwood, angel's trumpet, thorn apple, or devil's trumpet. But the most important ones are thorn apple or Jimson weed. Now, look at the mnemonic here. If you don't remember, if you have heard of this phrase, dry as a bone, hot as a hair, this is dry and hot skin. Then red as a beet, beet is beetroot. Okay, red as a beet is we're talking about the dilated vessels because of the flushed face. Then mad as a hatter, which is talking about the delirium. And then diplopia is talking of blind as a bat. So remember, dry as a bone, hot as a hair, red as a beet, mad as a hatter, and blind as a bat. So if you remember this, you will also remember some of the symptoms at least. So next, a man developed seizures and had normal consciousness in between after taking a local medication and developed arching of back also. What is the likely toxin? So look at the question here. He's talking about seizures. They're talking about seizures which are normal in between, and they all are also talking about the arching of the back. Then an important thing here is to look at the picture. Now what are we dealing with? We are dealing with the spinal poison. What kind of spinal poison? A spinal poison that is known as nux vomica. So look at these disc-shaped structures which are also disc-shaped like RBCs. So they resemble RBCs. They are also known as a button poison or a dog button. So which are actually accidental poison. So because animals like dogs, they can eat these poisons easily because they're small in size and they're easy and odorless. So then this nux vomica should contain the toxin that is strychnine. So your correct answer is strychnine. Why is Nerium odorum oleander not an option? Because this is a cardiac poison. What is Datura? Datura we discussed, it is a deliriant. Then what is hyoscine? Hyoscine is another toxin along with atropine that is present in Datura. So the option correct is strychnine. Now, if you look at the fruit, you've seen the seed. Now look at the fruit. So again, I'm telling you, always and always remember, it's good to Google pictures. Whichever is the best picture out of that, you should know that all parts of the plant you should be knowing. Then what is this position here now? This is the arching of the back that in the question it was. So if it is a hyperextension like this is known as a opisthotonus position. So this arching is known as opisthotonus. Now what is this? This is hyperflexion of the body, and this position is known as improsthotonus. So you can get a question like this directly: poison showing improsthotonus, poison showing opisthotonus. So the correct answer is strychnine or nux vomica. And if there is a extension or a lateral flexion or arching, this is known as a plurosthotonus. So these are just position names: opisthotonus, improsthotonus, and plurosthotonus that you should know. Then a very, very, very important finding. This is known as a rhesus sardonicus. This is a grimming or a grimace present over the face. So the muscles are clenched, the teeth are clenched, the jaw is clenched, and the person might show this finding also known as a rhesus, also or a rhesus sardonicus. And then strychnine poisoning is compared with tetanus poisoning. Why are we comparing this? This is a medical legal importance that strychnine poisoning is causing all muscle to be involved at the same time of convulsions, whereas tetanus convulsions do not have all muscles affected at the same time. A very important, again, a distinction is the question also stated that the muscles are relaxed in between, whereas in strychnine, in tetanus, it is not so. They are stiff and not fully relaxed. Remember this. And the best finding or the laboratory finding will be positive for strychnine poisoning, whereas the bacteria will be poison in tetanus. What is that bacteria? It is Clostridium tetani. So Clostridium tetani will be present in tetanus injury, whereas a strychnine positive test will be there, a toxin test will be there for strychnine poisoning. Okay. So moving forward, we are talking about question number 6. The following image shows what postmortem finding in a case of death by burns. So this is a dead body that is in front of you. That is obviously a postmortem case. And now we have to look at this feature What is this feature? Now let's look at the options. A is incised looking lacerated wound, B is antemortem incised wound, C is a heat split, and D is red line of demarcation. So this is a post-mortem case. So during autopsy, the finding that we are seeing here is this is a heat split. Why is this a heat split? What is a heat split? A heat split is just a post-mortem rupture of skin due to handling or moving the dead body. And now why is this compared to other things? Because it looks like some injury has happened over here, but eventually once you see this yellow surface and you see no vital reaction and no red line of demarcation, it automatically means that this is a post-mortem feature. Okay, so heat split, also known as heat rupture or heat laceration, they are post-mortem features, whereas incised looking lacerated wound is an antemortem feature. And antemortem incised wound is also a sharp a wound caused by a sharp weapon which has clean cut margins. What is red line of demarcation? Red line of demarcation is basically means that this is a line that is demarcating the burnt versus the unburnt area. So in it is an antemortem burns finding. There will be a line of hyperemia and paleness, and this will differentiate between the burnt and unburnt areas. So this image in front of you is of a post-mortem finding, which is a heat split. Look at this image. The first image is showing you a clean cut margin. What is this? This is now an incised wound. So antemortem incised wound, look at the red base, look at the vital reaction that is in the edges. So this is an incised wound. Now what is the second image showing you? The second image is showing you, look at these fibers. If you're able to appreciate, these fibers here at the base are known as bridging of fibers or tissues. And why are we seeing these bridging? These are seen in incised looking lacerated wound. So a wound is actually a lacerated wound, but it is caused by a heavy sharp a heavy blunt weapon, and that heavy blunt weapon will cause the wound to look like a incised wound, and the tissues will split open. But because of this base, the bridging of the base will show you that this is a incised looking but lacerated wound. And what is the third image showing you? This is a perfect clean cut wound again. So this is also an incised wound. So it's good to differentiate and look at different pictures only and only to understand how to attempt these questions. So let us look at the difference now between a heat rupture and a lacerated wound. A heat rupture is caused by exposure to heat, obviously, and a lacerated wound is caused by a blunt force. What is the heat rupture occurring? Where is it occurring? It is mostly occurring in the fatty tissue, as we saw in the image, whereas a lacerated wound will occur anywhere because this is an antemortem thing that is happening. Anybody can hit anywhere, whereas this stretching of these fatty tissues will cause heat ruptures. Vessels and nerves are intact here because it is only causing the fatty tissue to separate, whereas vessels and nerves can be torn in lacerated wounds. Bruising around the margins are not present. So it is absent in heat rupture, whereas it's present because of the blunt force that is used to cause these lacerated wounds. And what is this image showing you here? Look at here, the pink part above and the pale part below. just showing you a red line of demarcation between the burnt and unburnt area. Next question. A person in an attempt of suicide drank some household bathroom cleaner and the following post-mortem finding was noted in the stomach. So that means the post-mortem finding is noted during autopsy. They've taken out the stomach. This is somewhat brown to black appearance of the mucosa. And the hint that they've given you is that some household bathroom cleaner. So in India, household bathroom cleaners are usually acids. They are not sold directly in the market. They are not sold under a brand name. They are usually acids. So what can be caused? What can be the causative agent here? Let's look at the options: phenol, sulfuric acid, nitric acid, and formaldehyde. So the acids here are which can cause this brownish blackish appearance is a sulfuric acid. So the option sulfuric acid is correct. Whereas when we look at these two poisons, these two corrosive poisons, if somebody ingests them, the differentiation should be proper. Nitric acid and sulfuric acid may resemble, the findings may resemble, since they are both corrosive poisons, both very harmful agents, but a nitric acid will be colorless, pungent, and the sulfuric acid will be odorless. So it is easier to take this accidentally and also for suicide, because a person wants to drink this poison that is easier to ingest for suicide, and accidentally also because it is odorless, whereas this pungent smell will give away the nitric acid, and the fatal dose is lesser in sulfuric acid whereas it is more in nitric acid. The more important finding here is corrosion of trachea and black charring of stomach is more common in sulfuric acid, and definitely perforations will be there in sulfuric acid, whereas a nitric acid may not have perforations but the stomach is just ulcerated. This is in front of you is phenol. So phenol, also known as, we use the term phenyl, but the correct word here where we're talking about phenol is a disinfectant fluid, and it is sold under brand names like Lysol, sold under brand names like Dettol. So phenol at some concentration are present in Lysol and Dettol. Okay, but phenol will not cause this blackish brownish appearance or perforations of the alimentary tract, whereas it will cause a whitish deposit in the whole alimentary tract. Now, very important thing also here is between these poisons, what is contraindicated? So something that we should also discuss, what is contraindicated in nitric acid and sulfuric acid. The treatment that is contraindicated is gastric lavage. It should not be done in corrosive poisons. Whereas, what is that one corrosive poison in which gastric lavage can be done? It is actually phenol. So, phenol also being a corrosive poison, but here gastric lavage can be done because perforations and ulcerations are not there with phenol, whereas in other acids, those are more common. Now, what is the whole crux? What is the whole pathophysiology? How does it enter your body and what happens? So any part of the body, because of this corrosive substance, eventually you have to look at that conversion of hemoglobin to hematin. This breakdown of hemoglobin to hematin will cause the brown color to appear in the mucosa. So that is why those brown deposit is there in the tissues. Question number 8. A person who came with suspicious history of assault presented with the following injury. Identify the injury. So now look at the image carefully. You have to identify what is the suspicious history, and this suspicious presentation. So remember, when a suspicion is done, that means something which is actually presenting is not related to the history. So what you see over here is, you see that you see a incised wounds, and then you see some abrasions. So look at here, you find scratch abrasions and you find incised wounds also. Now, when you're finding such images, you will be confused between the given options, which are hesitation cuts, iatrogenic injury, fabricated wound, and scratch abrasion. So, you are confused that if it is hesitation cut or if it is fabricated wound. Let's leave out iatrogenic injury and scratch abrasion out of the fact, because obviously the scratch abrasion is in front of you in this picture, but we are talking about something suspicious, and we are also seeing some incised wounds that are here. And then we let's leave out iatrogenic injury also, because iatrogenic injuries are accidental or injuries created by doctors, more commonly by surgeons. So let's look at hesitation cuts and fabricated wound for now. So hesitation cuts are there in people who have suicidal tendencies, and they will give themselves these hesitation cuts mostly over the forearm. Why do they do that? Because they won't have suicidal tendencies, so they end up cutting themselves, which are parallel to each other, and they are mostly present over the forearms or extremities. Okay, now fabricated wound, why have we included here? Because we see two types of injuries over here. We find random haphazard scratch marks that are here, scratch abrasions, and they are incised wounds over the top. So this is a fabricated wound where the person will present with a history of assault by sharp weapon, but you also see that a person has been abraded by some blunt force eventually, and this sharp weapon is made over top of it, and these are fabricated wounds or factitious wounds or fake wounds that have been created by the patient to get monetary benefits or other benefits from the assailant. So let's look at this picture. This picture shows you that there is a laparoscopic surgery that is happening, but there are these wounds that have been created by the ports or the laparoscopes that we use, and these are known as iatrogenic wounds or injuries. And what is this picture here? This picture is here just to show you that a scratch abrasion more closely. And why should we remember that a scratch abrasion, also known as a thorn abrasion, is just and just the epidermis. When it is gone, obviously abrasions are when we are talking about only the epidermis, but in a single direction, scratch abrasions can occur. Next question. The following firearm injury is called. Now you have an image. Now let's look at the options. So when nothing much is given to you, first look at the options and then look at the image. So it is a Kronlein shot, a blowback shot, a short exit wound, a near range contact shot. What is it? Now let us look at this picture. This picture shows you some wound over the head. Obviously this is a firearm injury. What are the clues? The clues here are, we find that a stellate shape or a star shape wound is there. What do we see? We find some blackish deposit present over here. This is a known as the soot deposit, and also we find the margins to be inverted. Now, what option should we leave out? This inverted margins, soot deposit, stellate shape do not correlate with the shored exit wound. So let's leave this option out. Now, the other options, Kronlein shot, blowback shot, or near range shot, contact shot. So if it is a near range contact shot, okay, near range contact shot will not have a stellate shape. It will have a soot deposit, it will have inverted margins and other findings that like abrasion collar we are seeing here. So a near range will not be stellate. So let's take this out also. Now, should we include blowback shot or Kronlein shot? So the terms when they are given to you like this is not a perfect Kronlein shot, but also not a blowback shot. A blowback shot is nothing. The term correct here is a blowback phenomena, and no term exists like a blowback shot. So blowback phenomena is a phenomena seen in hard contact shots, and what happens here is the gases, they enter the wound, and these gases, since because of the contact of the weapon, they enter the wound, and because these gases want to come out eventually, they will evert the margins. So here we see inverted margins. So obviously this is not a blowback shot or a blowback phenomena. So the correct option here is a Kronlein shot, but this is not the perfect description. So the perfect description of a Kronlein shot is when it is a headshot and the brain matter is coming out of the skull, and then it is a headshot or a Kronlein shot. So that is why when you are given such images, just look at the most perfect answer that you can tick. Okay, what is this image showing you? That an entry wound will have inverted abraded margin, whereas an exit wound will have everted margins. So that is why just a differentiation here. What are these two images showing you? These images show you one particular difference. If you observe, you look at this here, this is a abrasion collar. What is an abrasion collar? An abrasion collar is also known as a frictional collar because of the entry of projectile. So why is this entry causing an abrasion collar? Because the bullet or the projectile is moving in a gyroscopic manner or motion. So this constant rotating motion of the bullet is causing a abrasion collar, whereas when you do not see abrasion collars here, you find some everted margins, and you may be also confused if they are inverted, everted. They are an image here to show you shored exit wounds. What are shored exit wounds? Shored exit wounds are basically when exit wounds are protected by a hard surface. So whenever there is a bullet coming out here, and imagine if there is a wall present over here, so the bullet strikes the wall or this hard surface, which could be a floor, and the bullet goes back and hits this skin over here. So this eversion will now have inverted margins again. So there will be inverted margins here, and you will not see the typical everted margins in how you see the exit wounds, but these exit wounds which do not show you typical everted margins are known as shored exit wounds. Next question. Postmortem examination of a death by alleged history of firearm injury showed the following fracture. So when you have fractures that we're talking about because of firearms, remember, now look at this image here. It is showing you a fracture that is going in a particular direction. So these fractures are most easy to recognize. So it is not a pond fracture, it is not Ellis type 2 fracture, it is not an elevated fracture. The correct option is a gutter fracture, that is the most common in firearms, also known as a keyhole fracture. Keyhole fracture has a slightly different appearance as the gutter fracture, but both are associated with firearms. Okay. What is a pond fracture? If we have to talk about, a pond fracture is a indenting type of fracture in infants. So infant skull is very soft. So whenever some blunt force hits the infant's force, the indent here, which looks like a pond here, is called a pond fracture, or also known as a ping pong skull fracture. So like the ping pong ball, like the table tennis ball, it is very soft. So once you press it, it will cause this pond to appear. So that is why it is called a ping pong fracture or a pond fracture. What is Ellis fracture? Ellis fracture are fracture of the teeth. Okay, so forensic odontology will take care of fracture of the teeth, where multiple classes and consideration is there. Some have enamel inclusion, some reach up to the dentin also, but Ellis fracture are dealing with teeth and not with skull. Now this is an image showing you a keyhole fracture. So keyhole is basically how you have a lock and you have a keyhole there. So this resembles the keyhole here. So what is this? The projectile, when it comes at a particular angle at this surface, it will create this keyhole or this gutter formation to eventually take place, and this is known as a keyhole or a gutter fracture in firearm injuries. What is this fracture here showing you? Another important fracture that we see in forensics. This is known as a motorcyclist's fracture. Very important to recognize all kinds of fracture, all kinds of images, because mostly you will just be shown a image and you should pick up that image without even looking at the options. So when you have a motorcyclist fracture, which is a fracture going through and through, so a through and through fracture from one parietal bone to the other parietal bone, from the sella turcica or the sphenoid bone, and then it is known as a motorcyclist's fracture, where the skull divides into an anterior half and a posterior half. So here two halves are separated, the skull divides like this. This is known as a motorcyclist fracture. Obviously, very commonly seen in motorcyclists who are traveling without helmets. So once they hit another speed moving vehicle, so this fracture is most common seen in autopsy. What is the image showing you, and what is the next question? The following is true regarding the postmortem change shown in the image given below. What is the thing? We have to look at the options. Due to aseptic non-bacterial cause, it is associated with the case of lightning seen within 24 hours of death, and due to sulfhemoglobin accumulation and formation. Look at the image. What is this image showing you? This image is showing you some blackish deposit which is there eventually along the blood vessels, and this looks like that something is deposited in this blood vessel. What is this phenomena known as? This phenomena is known as marbling. Now what is marbling? It is a postmortem finding in autopsy. And what is this due to? This is due to putrefaction. So let's now look at the options here. The options are due to aseptic non-bacterial cause. Obviously, this is wrong because putrefaction is due to septic or due to bacteria that is growing inside these blood vessels. It is associated with the case of lightning. No, we'll come to that. Why is it resembling lightning? Seen within 24 hours of death? No. 24 hours of death will not show you putrefactive features like this. At least more than 36 hours of death or post-death should have been completed to show you marbling. It is due to sulfhemoglobin accumulation and formation. So very correct in saying that, because this bacteria will eventually cause hemoglobin conversion to sulfhemoglobin conversion, and this will be the cause of this greenish blackish formation because of the gases building up inside. So look at here. Here the sign, this is a very important putrefactive sign, or the first sign of putrefaction that is seen externally is a greenish deposit over the right iliac fossa. So greenish blackish deposit over the right iliac fossa is because of the gases that are putrefying inside or building up inside the cecum or the ileocecal junction. So these gases here eventually build up, and the first sign that we see outside is a greenish deposit in the right iliac fossa. Then this image shows you a more further stage of marbling where the color changes have appeared, the marbling has spread to the whole of the body. So eventually putrefaction is taking over. Why are we referring lightning burns to, why are we mimicking lightning burns to marbling? Because lightning burns also resemble this ferning pattern, which is known as also Lichtenberg flower or filigree burns, which are seen in only lightning injuries. So whenever a bolt of electricity hits a person, these filigree burns or lightning burns can be seen. They are not seen in low voltage or high voltage electric injury. So not seen in this, but only seen in lightning injuries as ferning pattern. What is the next question? A 7-year-old child presents with history of perianal pain and is brought to the hospital. A specimen collected from perianal region is subjected to a specific test, which results in formation of yellow rhombic crystals of spermine picrate. What is the name of the test performed on the specimen? So now remember, when you're talking ki, if a person is brought with a perianal pain and the specimen is collected from the perianal region only, and now we have this image in front of you, and you have this clue also, spermine picrate. Even if this spermine picrate is not a part of the question, your correct answer should be that it is a Barberio's test. Why is it a Barberio's test? Because we are talking about tests on semen or seminal fluid. And what are the tests that are associated with seminal fluid? Either Florence test or either Barberio's test. But Takayama and Tickman test are dealing with blood. So we are talking about a perianal pain of a 7-year-old, most likely a case of sodomy, where this child was a passive agent, and we want to rule out sexual abuse, rape, and we eventually do these tests on the fluid or the suspected stain that is present over there. So it is a Barberio test, because Barberio's test or reagent will give you yellow needle-like rhombic crystals of spermine picrate, whereas a Florence test is not going to show you yellow rhombic crystals. It is going to show you a dark rhombic crystal of choline periiodide. So remember, two tests are there, Barberio and Florence, that are there for seminal contents, and Barberio will show you yellow needle, whereas Florence will show you dark rhombic. Barberio test is going to be having picric acid inside it. So picric acid test is also called as Barberio test, whereas a Florence test is going to have to detect choline. Okay. Just some image showing you about the blood test that we talked about, Takayama test and Hemin or Tickman test. So both have the same meaning. Hemin also known as Tickman test. They are the blood tests. One test will show you on a suspected stain if you feel like it is a blood or not. Then the suspected stain will show you pink needle shaped crystals of pyridine hemochromogen. That is the Takayama test. So if a blood test, if the suspected stain shows you dark rhombic crystals of ferroprotoporphyrin, then it is a Tickman test. So both these tests are there for blood, suspected blood, and they were, the Barberio and Florence was for suspected semen. What is the eye sign given in the image below? the eye sign image given below, everything is talking about eyes here, Kevorkian sign, tachynoir, corneal change after death, and changes in vitreous humor. But very important to note here is the image shown you here is of a tachynoir. What is tachynoir? Tachynoir is when eyelids remain open after death. So here this is an autopsy finding showing you in eyes that because this deposit is here along the eyelids wherever it was open, so the place where it remained open, so because of this debris formation which is embedded into the sclera is known as tachynoir. What are the other things showing you here? Kevorkian sign is a sign seen in the retinal vessels. And what are the other signs talking about? Corneal changes after death. This is only and only opacity in the cornea that we're talking about. What are the changes in vitreous humor? You cannot observe the changes in vitreous humor like this. You have to go into the posterior chamber. So you have to aspirate vitreous from there and then observe the levels of potassium inside it, which will increase after death. So remember that this sign is tachynoir, which is only showing you some deposit on the sclera. What is this image here showing you? This is the Kevorkian sign seen by an ophthalmoscope, obviously, and not by a naked eye examination. What is this image showing you? This is showing you a opacity of the cornea after death. So these changes are there post death.